Hi, I'm Kristen Stiegler, and I'm a Senior Project Coordinator with the Center for Health Workforce Studies at the University of Albany. I would like to present a poster titled A Profile of New York State's Patient Care Nurse Practitioners. Nurse practitioners, or NPs for short, are registered nurses with advanced education and clinical experience who provide a wide array of health services. NPs play increasingly important roles in the delivery of primary care services across the state, particularly in underserved communities. Since 2015, all NPs in New York State are required by law to provide additional information via an online or paper survey to the state at the time of their triennial re-registration. Using this survey data, we processed the information and removed any duplicates, as well as validated other data. Any NPs who are not working in New York State or not providing clinical care, such as those who were retired or teaching, were also removed. This left a final data set of 14,329 active NPs practicing patient care, also called patient care NPs. Our research examined the demographic, educational, and practice characteristics among New York State's NP workforce. We also identified the characteristics associated with working in a primary care health professional shortage area, also known as a HPSA. Our analysis found that statewide, there were 74 patient care NPs per 100,000 population, though regional distribution varied widely. Over a third of patient care NPs provided primary care services. Overall, the state's patient care NPs were not as racially and ethnically diverse as the general population of New York State. Hispanic NPs remain underrepresented compared to the state Hispanic population. On the other hand, Black NPs and American Indian NPs were comparable to their presence in the state's population. We also found that NPs in younger age cohorts were more racially and ethnically diverse than older NPs. Over 38% of NPs under the age of 50 were racial and ethnic minorities compared to only 25% of NPs 50 years of age or older. Finally, our research showed that over 43% of patient care NPs in New York State worked in HPSAs. Of all primary care NPs, almost half worked in primary care HPSAs. Nearly 61% of patient care NPs who worked in primary care HPSAs worked in outpatient settings, which include health centers or clinics, federally qualified health centers or FQHCs, rural health clinics, hospital outpatient care, physician practices, independent NP practices, and state or county public health departments. Lastly, a multivariate logistic regression model showed that NPs who worked in rural areas were more likely to have worked in primary care HPSAs than NPs who worked in urban areas. Increasing costs for healthcare coupled with shifting population needs, demographics, and distribution stress access to care and service delivery concerns, especially for New York State's vulnerable and underserved populations. Patient care NPs are able to deliver necessary quality healthcare services and are more likely to serve in underserved areas. Progress is being made to diversify the NP workforce, as the percentages of Black and American Indian patient care NPs are similar to the percentages of Blacks and American Indians in the state's population. However, Hispanic patient care NPs remain underrepresented compared to the percentage of Hispanics in statewide population. In addition, as a result of the COVID-19 pandemic, changes in the delivery of healthcare services, NP scope of practice, regulatory flexibility for licensure, and the redeployment of the healthcare workforce to areas of acute need occurred. In the future, research should be conducted to evaluate the impacts of COVID-19 on current supply, demand, and educational pipeline on NPs. Also, a closer look at the aging NP workforce and the retirement intentions of NPs could be made to understand the potential impacts on NP distribution and access to care for rural, vulnerable, or underserved populations in New York State. For more information about NPs or on other health workforce topics, please visit our website at www.chwsny.org. Thank you.